you're watching Hindustan Times. I'm Aditi Prasad. Amidst an unprecedented surge in COVID-19 cases, there are good Samaritans across Delhi, NCR, and India who are coming up and making themselves useful in the most important way possible. Online platforms have been flooded with requests for plasma donations, and joining me today are Adnan Shah and Sanjay Raina, two good Samaritans among the many who have been providing assistance to those needing for help in the National Capital Region. They have formed a Twitter handle called @Plasma NCR, and they claim to be resolving more than 100 plasma requirement SOS calls a day amidst a deluge of requests, of course. Dr. Sameer Kaul also joins us on the show to explain the do's and don'ts of plasma donations because there is a lot of confusion around them. People are running helter-skelter looking for plasma at all places. Let me start with you, Sanjay, and let me ask the most important question to you. How many people are you able to help in any one particular day, and in what manner with this initiative of yours?
Okay, as far as, hi everyone. As far as plasma is concerned, definitely a minimum of 100. Definitely a minimum of 100. As far as beds and oxygen and, all other things are concerned, I think the best that we can do is amplify. And I think I'm amplifying more than 500 odd tweets a day.
Okay.
So, and a lot of them, somehow someone is always helping someone. So some get converted, I'm sure. In fact,
Right.
a lot of them do write back and say this is done. So that is nice. So
I mean, that's the beautiful thing about this pandemic. I mean, amidst all the doom and doom, there are these stories of people coming out to help one another, people helping one another selflessly without any vested interest. But I want to ask you, because I try to help a few people source plasma myself, some friends and family, relatives. It was a really bad situation. I mean, even I, as a journalist, could not really provide much help. How is it that you are, sort of connecting people to sort of help take forward this initiative? How are you getting this list of plasma donors? What sort of sourcing mechanism have you created between you and Adnan?
all right, the mechanism that we've created is very human. It's not mechanical. What we've done is Adnan and I have been extremely proactive about it, and so we are constantly collating our donors and their data every day. We're up, I think, 20 hours a day. So we're not looking at whether this is B, the group is B or A negative or an O negative or whatever. We are just getting our donors together. And at the same time, we're also just getting our requests together. And we're kind of just matching them. Whatever can just fit. We're just doing a nut and bolt.
Okay.
Whatever is fitting wherever just goes. And so, while if Adnan is doing the donor bit, I'm doing the request and the case closing bit, or the reverse. So we are both completely at it, both doing the same jobs, yet different jobs at the same time.
Okay. Let me come to you, Adnan. For every one person you're able to help, I'm sure there are many that you're not able to help. It's clearly not a pleasant feeling. I know from my own personal experience, when you're not able to help and a person dies, or a person, is no more, then it's a very hollow, empty feeling. How are you coping with that?
Actually, it had been, I think, from the starting of pandemic, on a daily basis, me and Sanjay, we filled about 250 to 300 requests for plasma only. And we are able to successfully close around, I think, 150 or 100 to 150. So somehow the requests for plasma do not attract quick responsiveness, and we decided to step in. Our Twitter handle is a window where people can access our help by directly messaging us. So when in the case when the recipient is not able to connect with the donor, or when there is a problem in the testing of the antibodies, either if there is no match in the antibodies, and donor or this donor is not able to donate the plasma, we only did one thing: we keep the request open until it's not closed. From the starting of COVID, it had not happened yet that the our some of our requests we closed by our own, and we amplified some. They were closed by some other people, but it had never been done. अभी तक ऐसा कभी हुआ नहीं कि किसी को अभी तक जो भी रिक्वेस्ट हमारे पास आई उसको प्लाज्मा मिला नहीं. But I think this plasma do not attract quick responsiveness, and we decided to step in. Our Twitter handle is also a window where people can directly access us for the plasma and for the beds. But we are strictly on now. Now we are strictly on plasma only, and we are trying our level best to connect the recipient and the donor.
Oh, okay, all right. Thank you, Adnan. Dr. Kaul, I want to come to you at this point, and there are a lot of questions that I have for you, but I will start with the very basic. What really are the do's and don'ts that a plasma donor, a potential plasma donor, needs to know and follow?
Uh, Thank you for having me on the show, Aditi. And
Thank you.
thank you, Sanjay Raina and Adnan at Plasma NCR for incorporating me at some point of time. You know, I'm a surgical oncologist, but perhaps the resources, the time, the effort that was demanded by COVID at this point of time, preferentially over others, has drawn me to it, and I'm learning more as I go along. First of all, let me make it very, very clear. Plasma therapy, convalescent plasma therapy, as it is called in scientific language, is not a panacea for COVID.
Right.
It is not something that needs to be used on every patient because it doesn't help. It helps specifically patients who have early in the disease, have moderate COVID, and at the same time have probably have immunocompromised status because of other reasons. These are the people who should be receiving this therapy, and always under the expert guidance of their physicians. It is not something that needs to be given to everyone. I'm reiterating it. For instance, it's absolutely worthless in people who are on ventilators with severe COVID. It won't help at all. Now, that is the people who should receive it. Now, who are the people who can donate it? You know, the United States FDA, the federal agency in the United States, gave emergency authorization for convalescent plasma therapy for COVID-19, and people who have recovered from COVID can donate. They are the ones who should donate. There are specific do's and don'ts which are governed by the laws of our land very, very clearly. And people who have, you have to have recovered from a COVID infection. And after that, you need to have enough antibodies, proteins in your blood. Your blood is about 55% this little yellow clear fluid which contains antibodies, and the rest is RBCs and other corpuscles. They don't help because that goes back into the donor body. We just remove the serum because the serum contains these beautiful anti-COVID antibodies which identify the virus and mount an attack on it. So people who have recovered, and at least about 30 to 50 days after they were tested positive, or those people who were 2 weeks after the cessation of all their symptoms, when they fully recovered and their symptoms, at least 2 weeks after that. And even then, we always test you. We test you for the presence of enough antibodies because you require enough antibodies if you want to give a gift of life to somebody, to decrease the severity of their infection or decrease the time that they spend in the hospital, because these are the two things that convalescent plasma therapy does. It doesn't do wonders completely. As long as you understand, it is one of the things that has started being used in New Delhi, in Maharashtra, in some major metropolitan cities in India now. But I'm reminding you again, has to be done inside the hospital under guidance. And people, when you donate, you can donate every 2 weeks, really, because it doesn't weaken you at all. And there are always, for any procedure where it's infiltrative, because the needle is stuck into the vein and you remove the blood and it comes back into your body, there are always small risks involved with every procedure. And these risks are almost minimal in these cases. It doesn't make you weak, but you have to be on guard against allergic reactions, hypersensitivity reaction. So therefore, you need to be observed for a little while once you've donated. It takes about an hour and a half to donate, usually on an average. And some tips for people who want to donate, my friends: please don't consume alcohol at least 24 hours before you donate plasma. Why? Because the alcohol could transmit, traces of alcohol could stay in your blood and they could get transmitted to the people that you give your plasma to. And that alcohol is a blood thinner in itself, it thins blood. Also, avoid heavy meals and smoking and things like that before you donate. And who are these people who can donate? Very, very important question. Anyone between the age of 18 to 55 is a good candidate, provided their weight is at least 50 kgs and above. People below that are, if you have uncontrolled diabetes or uncontrolled hypertension, please don't donate. Particularly if your blood pressure medicines have been recently altered by your physician, please don't donate. And if you're being treated for tuberculosis, or you're a cancer survivor, or you're somebody who's received immunosuppressing therapy after kidney transplant, please don't donate.
Right.
These are some things. And of course, very, very important, in this country there is a rule that if a woman has been pregnant, she shouldn't donate. I mean, you can ask me, it's a technical reason for that, but in other countries, in the developed countries, they can, only after they've been cleared by an HLA test. And that's expensive to do at our scale in our country, so we don't do it. We have a blanket ban. So even if there's been a stillbirth or a miscarriage, unless it's happened in the first 8 weeks, please don't donate. So usually more males than anybody can donate.
I think that is very useful information for our viewers, and I'm sorry you see me in darkness now, because that's the tragedy of or the problems that we encounter while working from home in this COVID environment. So my electricity is gone, but it will the backup will just kick in just a minute. It's not not kicked in yet. Normally it takes a minute. But having said that, sir, your point very well taken. Your point very well taken that it is not a plasma therapy, or convalescent plasma therapy is not a wonder drug. It is not it's not been seen to be effective, and not it's not a life giving therapy, so to speak. But when doctors, your own physicians who are looking at your patients, are advising it, then people obviously will try and get it from whichever sources they can. And that is where people like Sanjay and Adnan are playing such a crucial role. And I will come back to you, doctor, but I want to just talk to Sanjay, and ask, what made you and Adnan come together to start this initiative, Sanjay? Because as the doctor himself pointed out, that plasma therapy is not a sure shot effective treatment against the coronavirus. But why did you come together to start this initiative? How much of your time does this really take during the day?
Okay. To answer one part of your question about the plasma therapy not, being uh, the right thing or whatever. See, we are not doctors. So
Right.
if a patient has been prescribed plasma therapy, the patient has been prescribed by a doctor. So an attendant or somebody is seeking plasma on the request of a doctor or a hospital. And Adnan and I are only trying to facilitate it. Whether it works or not, honestly telling you, we don't, and we're not expected to have that knowledge.
Absolutely. Agreed.
So,
Absolutely.
so
Well,
So
point well
it's
taken.
it's like any other medicine. If
Yes,
somebody
because the
wanted,
doctors are themselves prescribing it, and therefore
absolutely,
people are hunting for it. Yeah,
absolutely.
absolutely. Right. And in the absence of any person or any organization that they can go to source this, they are turning to one another for help. And often,
Absolutely.
so in that sense, initiatives such as yours are actually doing a great service to humanity.
Thank you. Also, what's happening is, I think, um, you know, I'm sure there are so many other people who are helping with plasma. So what's happened is, we have just our contribution has just come in and helped people to control the rush. So if
Hmm.
somebody was going uh, to a place, if five people were going somewhere and they were doing three requests, and those five were also coming to us, and we are doing one or we are doing two, net eventually all five are getting plasma from somewhere or the other. So
Hmm.
we have just added to the stream, and and we are glad we've done that.
And so are the hundreds of people that you have helped so far with the initiative. A lot of people writing in, wanting to get your contact numbers. I'm just going to tell all our viewers that please go to the Twitter handle @plasma ncr and write to Sanjay and Adnan if you are in need of a plasma donor for your patient. If you're a caregiver, please reach out to them @plasma ncr, and I'm sure you will get adequate help. There's no point in me sharing contact numbers here. But I want to ask you, how are you, great service to humankind. What challenges are you facing in this initiative? You must be facing a number of challenges on a day to day
Lots,
basis when you're
lots.
saying that. Yeah. So, what are those challenges? Can you enumerate some of them?
Okay, so the first thing is, that we're trying to tell people. We've made a small little form on our pinned tweet, and we're saying this is a very short thing. For details, we're saying just fill this and just message it to us. Now, what happens is, a lot of people don't message it and they put it on the Twitter handle. And honestly telling us, we don't have the time to go through the timeline there, and as a result, we whatever we see, if we can just pop in a message and we say DM it to us, because it comes in a particular format, it becomes easier for us. One is that.
Hmm.
Secondly, you know and we understand their pain and their helplessness. Everyone is constantly trying to follow it up with more messages. As a result, what is happening is, we have decided that we don't want people to follow up with us, because it takes just that other minute from us. So if we
Right.
follow up with 150, 200 people, it's 2 hours off our time. So we've been trying to request people don't follow up. We're on it. We're at every case. We're this is what we are doing. And so these are the small challenges. Then the other challenge is, at times, you get hold of a donor, and the donor doesn't match because of whatever reasons. The doc is here. Um, and then, like Adnan said, we don't close. We will still keep the request open and send another donor and send another donor and send another donor, because we want it to close. So in the meantime, if they get it from somewhere else, brilliant. Because the idea is not who's doing it. The idea is that it needs to be done. And so as long as, whether it's us or somebody or somewhere, or
Somebody else,
uh,
as long as people are getting help, I think that's the main thing.
yes,
And let me come back to you, because there's some of our viewers who are watching this broadcast writing in, wanting to know from the doctor, how does plasma therapy affect a person in the short run? Are there any complications? I'm sure, Dr. Kaul, if you would like to address that question.
First of all, I'll reiterate again, like I said, that it is not a panacea. It needs to be given early in the disease, when before when as and when the oxygen requirement of that patient mounts, and when it starts dipping below 90, is when this thought of whether to use something else should come into the physician's mind. So it's scientifically proven to
Hmm.
decrease the hospital stay of
Hmm.
moderately severe disease. Moderately severe ill patients. When you get, COVID gets classified as mild, moderate, and severe on the basis of certain facts and characteristics, medical facts. And if
Right.
it's moderate disease and it's early on and your oxygen saturation starts falling, that is the time one needs to give due consideration to using convalescent therapy, plasma therapy, and then you start making at least having a conversation with your physician. And there are risks involved because you could, although the chances are very low, so you could be transmitting any infection like happens in blood. It's a transfusion at the end of the day. So there could be, if blood infected from donors with HIV or with hepatitis B and C, those infections can get transmitted. And sometimes, medically speaking, there is a chance of what we call as acute transfusion related lung insult,
Right.
where you get breathing difficulty and little platelets go into the circulation and damage the lung. That is sometimes known to occur, apart from a hypersensitivity to the proteins in the serum. But these instances are very, very low. That is why we've made sure that this is done within a medical facility under monitor of the department. So I would say that this is something that can be considered. It saves lives in those people where it works. It doesn't work all the time because I would be saying that would be a non-truth. That would be something, and I would not want to convey non-truths on national television to people who are
Absolutely.
really groping for straws at the moment, the kind of situation that exists around us. So I think you need to have a conversation. You need to know the facts. It is an established method of treatment of moderate COVID. It decreases the severity of the disease or decreases the time that you spend in the hospital. And therefore, in that sense, in those patients, it saves lives. That is why it's a serious affair. It needs to be at the back of your mind.
Absolutely. Thank you so much for that, Doctor. Adnan, I want to come to you and I want to ask you, बहुत अच्छा काम कर रहे हैं. Delhi NCR में you are helping a lot of people. Any plans to take this initiative outside Delhi NCR?
To expand our outreach so that nobody has to run around the plasma during hospitalization. So plasma NCR is a small beginning, and we hope to turn it into even more comprehensive and organized platform. Even I, on behalf of Plasma NCR and Sanjay Rana, I request everyone to do whatever they can do to ease the sufferings of other people. Our nation is in crisis. Also, I request people to stay COVID savvy. Do not take unnecessary risks by exposing yourself and others to potential infection. And never lose hope. We are expanding it to we are having our contacts in different parts. Even we have done many cases in Mumbai, in Gujarat, in many states of the India. So we are trying to expand it, and we are now planning. Me and Sanjay were on call, and we were yesterday planning to expand our outreach in order to save the patients, and nobody has to run around the plasma during hospitalization also. So do something, because we are doing this to expand our this plasma NCR network within few days, I think. But it's also based on how many patients. Actually, we are getting many requests from other states also. But the thing is, we are bonded to plasma, this Delhi NCR only, because there is a we are getting much more requests. Our Twitter, our Instagram, our WhatsApps, and our inbox texts are flooded by messages who are demanding plasma from the NCR.
क्योंकि दिल्ली में बहुत ज्यादा केसेस भी हैं, अदनान. दिल्ली में इस वक्त बहुत ज्यादा patients zyada hain, many of them not getting admission in the hospital because of lack of hospital beds, because of lack of oxygen. And on that note, I've taken enough of your time, Sanjay, but my last question to you, how can other people get associated with the cause?
See, firstly, I firmly believe that anyone and everyone should do whatever one can. So, COVID in itself is a big cause, not just plasma or something. So, if somebody can do food, you should do food. If somebody can help in driving, you should help in driving. If somebody can help in, sending chai, one should do it. If somebody can help in whatever, in plasma, in blood, uh, you just have to see what is your resource and what is it that you're okay to do,
Right.
and you should just do that. But anybody and everybody should certainly do something. It's a shame if each one of us don't do anything. What is within our means? What is within our means?
Whatever is within your means, please try and reach out, try and help people in this time of distress. That's the message coming in from our good Samaritans here, and the doctor, of course, explaining how and the do's and don'ts of plasma donation, and how it's not a wonder therapy that is definitely going to save lives, but it definitely, when your doctor advises it, obviously, it is something that can give you relief at some point in your disease. In the meanwhile, thank you for joining us, Sanjay, Dr. Rena, Adnan. Uh, to our viewers, please stay safe, stay tuned to Hindustan Times for all the latest updates. And if you have need for a plasma in Delhi NCR for now, please do go to the Twitter handle @plasma NCR and reach out to these two people who will try and help as much as possible. Thank you for joining us today.